to speak a little bit more about this. So we're on the line to Winnie Byanyima, Executive Director of UNAIDS and Under Secretary General of the United Nations. A very good evening to you, Byanyima, and thank you so much for speaking to us. So up until this point, we understand that these are rumors. Have there been any official government confirmations or repudiations of this leaked document, so-called leaked document?
No, not that I've heard. This agreement that is being negotiated is between one government and another, and we were not invited in the discussions. Sometimes in some countries we were asked to provide our data, and we did, but we were not sitting in the rooms in the discussions. So we can't say exactly what is in there, but what we know for certain is that the American government, after the major disruption of last year, this year came back with a new global health strategy of its own and made commitments, financial commitments, that put it back in the lead as the leading aid donor towards this disease of HIV. So we see all these agreements, but we are not sure what is contained in them, but they are focused on health. They use our global health targets, HIV targets, and they are being negotiated government to government.
So let's look at it from a principial level, Mayor Byanyima. What would your reaction be if it is indeed confirmed? And whether it is from a state to state or not, but just the principle of saying to another state that we will not give you life-saving medication unless you give us your critical minerals. You as a person and you as head of UNAIDS, on a principial level, what would you think about that?
Well, first let me put some facts on the table, that these agreements, many of them are for committing American resources, taxpayers' resources for the next 5 years. They also ask the governments to commit to increase their own spending every year, so that it is like a grace period for these governments to slowly or progressively take over paying fully for their health HIV responses. So they are mostly they are firmly focused on health. And then another thing about these agreements is that they are putting resources into commodities. That's the tablets that keep people alive. They are putting resources into strengthening data systems, surveillance systems, so that a country is able to manage on its own long after they've gone. So there are many very positive things about these agreements. However, the fact that they are done between government to government, senior government people, and there's little public participation, hardly any sharing of drafts, has made many people living with HIV and others very anxious about what is contained. So the question of transparency is an important one. It would be good if the American government opened the process like the PEPFAR process was, where the people affected by HIV, living with HIV, are part of shaping what a program will be. The second thing about the agreements is that they are committing governments to put their resources on the table. What I have heard from some countries is a concern, particularly by parliamentarians, that these agreements may be committing future budgets, and that undermines the role of parliaments, which are the ones which approve budgets from year to year. So the need for parliamentary review is also important. And so these MOUs, whether in Zambia or elsewhere, it would be important that they are brought within parliamentary oversight so that financial rules, constitutional guidelines are respected. And then for Zambia, Zambia has 1.4 million people living with HIV. Of those, 1.3 million are on treatment, are able to live good lives. That's a huge achievement for Zambia. Zambia has brought down deaths by 40%, brought down new infections by as much, and is on its way to fighting and ending AIDS, but always with global solidarity. And the biggest supporter is the United States, putting in close to 80% of their total resource.
And
92% of their funding for HIV comes from outside. So Zambia does need these resources to keep its people alive and keep the fight on. The question of linking this to minerals is a total surprise to me. If it is the case, then really it couldn't be right that people living with HIV, that their lives are put at risk or are made a bargaining chip for other issues. We would want the agreement to be strictly on HIV and with agreements on HIV, but not connected to any other issues.
And you made the very important point that, for instance, the WHO has impressed upon governments to raise their domestic spending on health to up to 15% of their national GDP. And it is important, which is what African governments are discussing now, that with the lack of direct financial aid from countries, they need to start being self-reliant. But as you touched on it, it's about the ethical aspect of it. I mean, if we look back at when we had vaccine diplomacy, that was something that was raised as, a very troublesome issue, to look at life-saving medicine as a bargaining chip. So as UNAIDS, what would you then say to both countries if this was something that's on the table? And if that is something that Zambia is willing to do, that's fine. But its sovereign health data and biological samples do point to an existing problem.
Look, Zambia is a sovereign state and exercises its sovereignty. Whether it signs what it signs, that is its responsibility. We, as UNAIDS, as the United Nations part that coordinates and leads this global response, there are several things we advise. One, of course, is transparency of such processes, such agreements, the way they are made. It's so important to hear people living with HIV and people at risk of HIV, our young people especially, to hear what their needs are and how they want to be served, so that an agreement is based on real needs of people and there's accountability for the results from those agreements. That's one. We strongly recommend that. And it's not too late. Even those who have already signed, more than 20 countries have signed, they are now moving to implementation planning. We strongly recommend that they open those processes of implementation planning to civil society, to the organizations of people living with HIV, to all those groups that are at risk of HIV infection, and to broader civil society to see what's in it and to plan where the money should go. That's one. Two, we also would suggest that these agreements are also reviewed by parliaments. This is about transitioning, and the US is right to encourage governments to work their way towards self-sufficiency on fighting this disease. But if it involves now planning how you will use future budgets, if it involves staff that you hire and put on a government payroll, these are things that must be planned properly, and that role is within the executive and overseen by Parliament. So again, we advise the American government to respect those processes, national planning processes, so that there is real accountability, so that money is spent properly. If it's not done like that, I can tell you, you have opportunity for waste, you have opportunity for corruption, and because nobody will have carefully planned and seen and put in all the benchmarks for measuring progress and all of that. So that's important. The last point is one I've heard about data, sharing data. Here I have heard several countries say that the provisions within some of the MOUs regarding data privacy that are impinging on data privacy, on patient privacy, their personal information, and that also about commitments about pathogen sharing or sharing information, data on information on surveillance information. These are also things to negotiate carefully and to bring in the views of national experts, bringing in the laws of the country and respecting them, bringing in also the perspectives of people like ourselves who are in those countries for that purpose, to provide technical expertise. WHO, UNAIDS, UNFPA, we are all there to support the countries to use the best science. And so agreements should be based on the best science, and we are there to provide it.
And just to hear your thoughts, particularly when looking at HIV/AIDS, the PABS that was signed eventually last year in Geneva, but which has been a long time coming in talks and disagreements on certain fundamental issues. Just on a general level, it doesn't sound harmful to share data on pathogens and etc. And either health system information and data. But what do you think seems to be the problem with African countries who are saying some of these agreements are lopsided? What would be equitable when we talk about pathogen access and benefit sharing?
Well, first of all, again, to repeat that we as UNAIDS have not been involved in the shaping of these agreements. And it is not easy for me to comment on what is in those. I cannot comment on what's in those agreements because I have not seen them. The principle I can make is this, that in the negotiation of the pandemics treaty, when the world came together to agree to make a framework that will secure the world when the next pandemic hits, that one of the big issues that was discussed is exactly that one, pathogen access and benefit sharing. What's that about? One, viruses respect no borders. They spread like fire. And in order to fight and end a pandemic or to stop a pandemic from spreading, you need to be sharing your surveillance information. Because remember, in your country, South Africa, you were a country that isolated one of the variants of the COVID vaccine, of the COVID virus. You identified one of the variants and you shared it with the world. So that's what's needed, that when you have vital information that can get us to find a solution quickly, you share it with the world. And that's why we have the United Nations, WHO, to share this information. So it's quite important that countries are open to sharing their data. But also underneath that, there's also issues such as patient information, patient records. Those are not supposed to be shared just like that, because this is your privacy. So there's several layers of this. There's patient information, there's surveillance information, there's other data, and what we need to share is that surveillance data about the disease and how it is being transmitted, and that we should be sharing through the multilateral system. That is the best way, that there is a system where every country brings what it finds, and then it can be used by those who can innovate and find solutions. Here with these MOUs, we don't know what has been put there. I cannot comment on that, but I would say that countries are right to insist that if we have our surveillance information, we want to share it through a global process that's owned by everybody so that everybody can access. And we also want to share in the benefits that come from that knowledge.
And just finally, given these dynamics that you mentioned, Wanyima, the commitment to remove AIDS as a public health threat by 2030, does it seem achievable?
It is achievable, but there are many challenges on the way. One of them is exactly this one of financing. The countries that have the highest burden of HIV are also the countries that are most heavily indebted. That now their debt repayments are sucking out of the budget the money that would go for health, for education, for social protection, all the things you need to do to fight this disease. So, access to finance, countries being able to negotiate their debt down and be able to borrow concessional loans that do not overburden them and lead them to these fiscal challenges that they have. This needs to be solved, the question of access to finance for developing countries. The second big issue is access to medicines. We have talked about this with you before, that right now, I was in America 2 weeks ago, they were advertising on TV. I saw the ad like 4 times in 1 hour, calling people to come to get their lenacapavir, 2 shots to prevent infection. Here in Kenya, I was there the other week also. They were celebrating the arrival of 20,000 doses. 20,000. What they need is 2 million to start with, but they are just getting a droplet. Why? Because the company is holding on to its knowledge, licensing only 6 companies who are not even ready to produce, and so the market in developing countries is not being served as they collect money from the rich markets, $28,000 per person per year. They don't want to license many companies so that we make for ourselves cheaply and stop this disease. So these are the issues. The failure, in fact, another company, Merck, is about to launch tablets, 12 tablets, 1 tablet per month can stop also infection 100%. Imagine just 1 tablet per month. If you're a young girl fearing to get HIV and you get your 12 tablets, you're good. But even that, it may take us years before we get the price down to serve our people. Those are the challenges. Otherwise, we could end AIDS by 2030.
Winnie Byanyima, as always, thank you so much for your time. Much appreciated. Underscoring the fact that we really need to start sharing intellectual property on these life-saving medications and allow, especially countries in the developing world, access to these licensing rights.